Mental Retardation by Jones HMMBADMS. Introduction. In each country, approximately 1% of the population have mental retardation. Mental retardation is a disability which starts before adulthood and has a lasting effect on development, producing a reduced ability to cope independently, impaired social functioning due to reduced ability to understand new information and to learn new skills, impaired intelligence. The essential features of mental retardation are a significantly sub-average general intellectual function, accompanied by significant deficits in social functioning in areas such as social skills, communication, and in addition difficulties in attaining personal independence and social responsibility. The onset of mental retardation must be before the age of 18 years. Causes of mental retardation. Causes of mental retardation are grouped into two, genetic and environmental categories. Problems with brain development intrauterine, which may be caused by different factors. For example, drug and alcohol intake by a pregnant mother, antenatal infection. Brain damage during birth. For example, encephalic pelvic disproportion, mechanical brain damage. In the prolonged labor, the brain is deprived of oxygen. Prematurity, brain not fully developed. Conditions after birth, e.g. meningitis, cerebral malaria, hydrocephalus. Head injury, caused by falls, penetrating, and blunt object. Drug use by the child, example marijuana, etc. Classifications of mental retardation. Traditionally, intellectual functioning has been measured by IQ tests, intellectual quotient, which refers to a person's ability to learn, reason, make decisions, and solve problems. A significantly sub-average intellectual functioning was defined as an IQ of 70 or below. However, IQ tests are now treated with some flexibility that might permit the exclusion from the diagnosis of mental retardation of some people with IQs lower than 70. This is the case if it is felt that there are no significant deficits in adaptive function, the person's effectiveness in areas such as social skills, communication, daily living skills, etc. Mental retardation can be further broken down into borderline, mild, moderate, severe according to IQ. The IQ level gives an approximate guide to the individual's general level of functioning. Borderline mild mental retardation, IQ 51 to 69%. They represent about 80% of people with mental retardation, and their appearance is usually unremarkable, and any sensory or motor deficits are slight. In adult life, most of these people are never diagnosed. Most of these people can live independently in ordinary surroundings, although they may need help with housing and employment or when under some unusual stress. Moderate mental retardation, IQ 40 to 50%. People in this group account for about 12% of the learning disabled population. Most of them can talk, or at least learn to communicate, and they take care of themselves with some supervision. As adults, they can usually undertake simple or routine work and find their way about. Severe mental retardation, IQ 20 to 39%. This group accounts for about 7% of the learning disabled population. In preschool years, their development is usually greatly slowed. Eventually, they may acquire some skills to look after themselves, although under close supervision. They may also be able to communicate in a simple way. These people can undertake simple tasks and engage in limited social activities. Profound mental retardation, 0 to 24%. People in this group account for less than 1% of the learning disabled group. Few of them learn to care for themselves, although some eventually acquire some simple speech and social behavior. Signs and symptoms of mental retardation. Though some children may not have been detected early, but later in life with minimal signs and symptoms, especially in mild mental retardation. Primary manifestations are delayed intellectual development, low IQ. Immature behaviour. Limited self-care. Motor deficit, flaccid muscles. Language delay and impaired ability to communicate. Anxiety and depression later in life because of discrimination, rejected by other children. Diagnosis of mental retardation. Diagnosis is made using intellectual quotient, IQ, and developmental assessment. Intellectual assessment can be class continuous assessment exams results below average sub-average may indicate mental retardation. Developmental assessment includes neuromuscular examination which will reveal retrograde neuromuscular function, flaccid muscle. Management. Multidisciplinary therapy. Multidisciplinary team is required that includes neurologists, developmental pediatrician, physiotherapist, orthopedists, occupational therapist, speech therapist and audiologist help with language delay or with a suspected hearing loss. Medical treatment. The medications most commonly prescribed for persons with mental retardation and mental illness fall into the following classes: antidepressants, mood-stabilizing agents, sedatives, hypnotics. Antidepressants. Antidepressants are used primarily for the treatment of depressive mood disorders. The newer antidepressants, often referred to as serotonin and selective reuptake inhibitors, SSRIs, have become the agents of first choice in most cases. They have also been used in the treatment of self-injurious behavior, obsessive-compulsive disorder, panic disorder, and Tourette's syndrome. Examples: older tricyclic antidepressants, amitriptyline, dothepin, nortriptyline, and imipramine. Newer antidepressants, sertraline, fluoxetine, fluvoxamine, nifazidine, and clomipramine. Clomipramine is a tricyclic which differs from the others in this group. Monoamine oxidase inhibitors, MAOIs, phenelzine, are rarely used in mental retardation due to side effects. Mood-stabilising agents. Mood-stabilising agents are used for people suffering from mood swings, commonly referred to as bipolar affective disorders or manic depressive disorders. The medications prescribed are diverse but have in common a propensity to stabilize central neuronal activity. These same medications are also used to treat non-specific aggression and over-aroused behavior of people with mental retardation and as adjunctive therapy for unipolar depressive disorders and psychotic disorders. Examples: benzodiazepines, diazepam, nitrazepam, lorazepam, alprazolam, clonazepam, and flurazepam. Non-diphenhydramine and benzodiazepines. Anti-anxiety, anxiolytic. Generalized anxiety is often first treated with medications such as hydroxyzine and buspirone. If these are unsuccessful, benzodiazepines are often used such as diazepam, lorazepam, or alprazolam. Prevention. Genetic counseling may help couple with high risk, e.g. couple with mental retardation, predispose the offspring. Prenatal testing, e.g. amniocentesis, which enables the couple to terminate pregnancy and subsequent family planning. Proper obstetric management, e.g. treatment of uterine infection, prevention of birth injuries, as in case of cephalus pelvic disproportion by doing cesarean section neonatal care. Proper and prompt treatment of infection, e.g. meningitis. Prevention of head injury,